Greetings. So today, as we continue our look at Ericksonian strategic therapy, I want to present the idea and the concept of this way of working as a strategic and strength-based approach to healing. So let me clarify what I mean by this. Most, not all, but most other psychotherapies are kind of a linear approach to healing. And what I mean is, uh, A will always lead to B, B will always lead to A. So, for example, uh, therapies that rely a lot on the cognitions and you know, irrational beliefs and those kind of things. Their idea is that our thoughts, our beliefs, are what cause our emotions and actions. So it's a very linear kind of way to work with people. So you go back and you adjust the thoughts because that's where it originates. The behaviorist perspective is that behavior in of itself is a patterning that needs to just be changed, programming that needs to be altered through some focus on the person's positive negative reinforcement, punishment, those kind of things. Some of the emotion therapies are our emotional state leads to this, and so we go in and work with the emotions. Again, all of these are great, and the research shows that the bulk of these work very well. But I just want to differentiate kind of the Erickson perspective on this. Ericksonian strategic therapy looks at the person as a whole, and even though maybe perhaps their thoughts are a contributing factor to their behavior and their emotions, we don't always feel that we have to always go there. I mean, certainly it might be something to investigate, but an example would be seeing people in kind of a box, as in they're in this box and we can only do one way of intervention with that person. That's a limiting perspective. We want people out of the box, metaphorically, because there's so much going on in their lives. For example, if they have anxiety, rather than attack the anxiety, maybe we work on change in another area of their life because we see those areas as systemic, as in connected. So when somebody is, let's say, having anxiety, and then you get them to spend more time learning their interest in calligraphy. Um, that sounds like it has no real connection there, but perhaps that ability to focus your mind, and if you know anything about calligraphy, you have to be very purposeful in how you move the brush. That might be a resource that gets activated in the person that can then systemically affect the anxiety. So we don't look at as strict limitations of a linear approach. I remember reading a story about Erickson, who was Dr. Erickson, who was working with a mother and a child, and the child was having issues wetting the bed a lot. So Erickson had the mother and the child work pretty extensively daily on the child's handwriting, and to really sit together and focus on how the child made those hand movements, similar to the calligraphy. Because if this fine motor skill activation and control can be affected in one area of the life, well, then how can it not affect another area of life? Same thing in family therapy. When you have systemic family therapy, you're working with the entire family, not just with the one family member that has the problem. Unfortunately, I see more and more family therapists, particularly new grads, coming out, and they haven't been quite shown a systemic view of family therapy, and that's kind of sad. Because if one child is the problem, well, you don't always have to go head to head with that child or try to eradicate that problem. You can work with other family members, and because it's a vast system, the system then has to adjust due to that new information and new interaction that's going on. So it's an systemic, but it's also strength based, meaning that we will focus on where the client is doing things right, where they are giving some area of success. And a lot of times just the activation of those patterns, the activation of those interactions in certain areas has a remarkable effect. in others. So if someone is dealing with a great depth of depression, rather than try to eradicate that, we will find out when are they not depressed, or when are times when they have less depression, and then we want to have them do more of that, or use that as a theme to move them out of their limitations that they have in their mindset into other things. So if a client says, I have depression, but some days it's not as bad because I get to go down and volunteer for the dogs to help take care of the strays, at the local SPCA. Well, then we might not only encourage them to do more of that, but maybe to get a dog. Whatever it is, to just kind of change and shift those patterns of interaction, the way they deal with their problem, rather than have this linear approach of eradicating the problem, or it always follows this straight line. Because a lot of times people might not want to let go of their problems. So rather than get into that battle with them, having that approach where you can see a person in a multitude of ways rather than just one linear approach, and to focus on what they're already doing well, or what they're doing really well that can be brought into the context of the problem. That's a pretty unique way of working. Something that Dr. Erickson was doing back in the 40s, 1940s and 50s. I mean, so the bulk of everyone then, not all, but everyone then was not strength-based. They were deficit-based. They weren't systemic. They were linear, very focused on pathology. So the more we explore kind of a strategic approach to this systemic strength-based work, it frees, I believe, the practitioner to have some pretty remarkable outcomes. So anyway, there's a little bit about how we're kind of viewing some of this basic idea of doing interventions. And as we go on in the video series, we'll be putting out some more ideas about specific ways to create change and to hopefully help others heal.